Before we begin our event, I'd like to start with a land acknowledgement, which is offered in recognition of the enduring connection of Labrador. We strive for respectful relationships with all the peoples of this province as we search for collective healing and true reconciliation and honor this beautiful land together.
To the importance of this announcement. Also, a special thank you to the Healthcare Foundation for all the work that you continue in ensuring that there's the appropriate provision of care for people across our beautiful province. My friends, our government knows that healthcare is in turmoil. We're not running away from that. We're not ostriching, and we know that. And in order to help attract and retain more healthcare professionals, we need better working conditions. Earlier this week, I met with the Atlantic premiers, and we committed to setting up an Atlantic registry to make it easier. I can tell you what a beautiful facility, a game changer for the west coast of our province. But beyond that, you could see the impact of a modern facility and how creative, remarkable. It means patients from communities like St. Anthony and Happy Valley Goose Bay can get the timely care that they need, happening at once, in parallel, not necessarily in tandem. Phase 1 involves rapid access to cardiology clinics, HeartForce One, virtual care, and traveling cardiologists, bringing care to people in all corners of our beautiful province. Phase 2 is integrating stroke and vascular care to provincial programs to join the cardiac program. And in Phase 3, we will and increasing the overall bed capacity to meet not only the demands of today, but the demands of tomorrow. This is an exciting day, one I know Dr. Connors is particularly happy about. But Labrador, thank you very much.
Thank you, Premier.
It is an unfortunate reality that our province leads the country in both burden and complexity of cardiovascular disease, and addressing those issues continues to be a priority for our government. Cardiac disease affects 1 in 3 people in Newfoundland and Labrador. It's a mouthful, but it's a very important mouthful. Aimed at the prevention and treatment of heart disease, vascular disease, combined with the treatment of strokes and other significant heart concern in our province. The new Cardiovascular and Stroke Institute will provide efficient, quality care in a modern facility. One all Newfoundlanders and Labradorians will have access to. We will now move forward with the request for proposals for the construction of this centre. Acting on this recommendation, coupled with, as well as the Health Accord team for their work in making this new centre of excellence a reality. I also want to acknowledge government's long-standing relationship with the Healthcare Foundation. It is a pleasure to work with Paul and his team. They support many significant projects that healthcare infrastructure needs on the Northeast Avalon. The aim is to help realign the delivery of healthcare services on the Northeast Avalon to increase access to healthcare and ensure the appropriate infrastructure is in place to meet future healthcare needs in the region. This Cardiovascular and Stroke Institute aligns with this objective. We know the cardiovascular disease and stroke need a shared approach to prevention and management. The new centre represents the organized structural focus for heart, stroke, and vascular care that is greatly needed in Newfoundland and Labrador. It also speaks to government's plan
to speak about the initiative.
Thank you, Ken. Premier, Minister, it's This is a really important day. February is Heart Month, and never in the history of Newfoundland have we ever had a Heart Month like this February. You know, it's a privilege disease, our burden of heart disease, and we don't want to just catch up. We want to be leaders, and this is the path that we can set in front of ourselves to allow us to get to where we need to be. This is transformative. What the Premier and the Minister have announced today is a transformative milestone. It's going to transform what we do in the future. But if you do need to come down, this gives us the infrastructure to give you access to what you need and capacity so you don't have to wait for all that time you've had to wait in the past. You know, none of the wait times in this country are probably where they need to be, but in Newfoundland we've all been challenged by wait times, especially coming out of the pandemic. You know, we've engaged with our partners in Central Health and in Western Health and in Labrador, and we've come up with a lot of innovative ideas. You know, it was Brendan Parfrey's idea, that whole Heart Force One and getting it off the ground and then bouncing it off our people that were in Labrador. And what did they think of it? Because if they don't think it's a good idea, it's not a good idea because they're the ones that are using it. But at the end of the day, that partnership, and soon we're going to be one health authority. So to have everybody together coming up with this innovation really filled me with hope about the future. So this is not a cardiovascular institute for St. John's or cardiovascular institute and stroke care for St. John's. It's the province's cardiovascular institute, just as much as it's, you know, for us as it's going to be for Labrador or for Western or for Central. And the capacity, the people and the technology to allow us to do that before we do it. And the last thing I'll say is that when we have a province like ours that is as innovative as ours and has a government that backs the innovation that we have, we're not just talking about infrastructure. Since this idea has kind of come together and has been forming, we've really attracted the attention of a lot of top heart team members across this country. And as a specific example, we have world-class surgeons that are kind of beating down our door saying that we want to come because we want to transform cardiovascular and stroke care, and we know what's going to happen in Newfoundland.
Thank you, Dr. Connors. It's now my pleasure to introduce Rhonda Neary, President and Chief Operating Officer of the Newfoundland and Labrador Construction Association, to say a few words.
Good afternoon. My name is Rhonda Neary, and I am the President and Chief Operating Officer of the Newfoundland and Labrador Construction Association. I'm honored to be here today with Premier Furey and Minister Osborne to announce the new Cardiovascular and Stroke Institute at the Health Sciences Centre here in St. John's. Thank you both for your commitment to our construction industry and the development of critical infrastructure. We welcome this exciting announcement. The investment in healthcare infrastructure will directly and positively impact the lives of Newfoundlanders and Labrador. With transformational changes to our healthcare infrastructure, the construction industry is committed to becoming a partner in these projects to bring them to a reality. A strong construction industry is critical to the success of our province. Investments in infrastructure benefit our economy. It improves the hospitals, the clinics, the community centers, the schools, and roads we all rely on daily. Today's investment in healthcare infrastructure is a positive sign of progress and hope for our members, and we look forward to seeing the impact
to any patient throughout the province. We're extremely proud of this clinic, as it is an excellent example of how we can use technology as a means to improve patient access to service despite our vast geography. Using remote patient monitoring and state-of-the-art video conferencing, people from all over Newfoundland and Labrador can now be seen by a cardiologist and the heart function team from the comfort of their own home. Through this innovative approach, over 50 of our province each year. This demonstrates a strong commitment to our population's well-being and to providing quality cardiovascular care in this province. Internally, we're creating partnerships which are important to providing optimal cardiac care that stretches across different medical disciplines, with primary health care being a strategic partnership. We'll be integrating the Newfoundland and Labrador Cardiovascular Institute with our collaborative team clinics, thereby strengthening the sustainability of primary health care and providing support to our providers in the community. The Cardiovascular Institute will be completed in phases as the premibility of acute care beds, creating infrastructure capacity for needed hybrid operating space, which can be used for traditional surgeries or interventional procedures, such as open heart surgeries, advancing innovation and academic research, and facilitating robust recruitment, retention, and sustainability within the province's health ecosystem. The Cardiovascular Institute will become the province's flagship for cardiovascular care. Aside from traditional diagnostics and intervention, the Institute will play a strong institute. I speak on behalf of the employees and physicians of Eastern Health when I say thank you to the Foundation and your donors for all your generous contributions and support. Thank you to all of our guest speakers for participating in today's announcement. It certainly is an exciting day for the province and for Eastern Health. We're steadily building